So the pleural cavity is this cavity surrounding the lung that is lined by visceral pleura on one side and parietal pleura on the other. Now, most of the pleural cavity, in fact, is lined by visceral pleura on one side and parietal pleura on the other. But as we get to the bottom of the pleural cavity, we see a region here where the lung does not extend down into, where the pleural cavity has parietal pleura on both sides because there's no lung in there. And that part of the pleural cavity is called the costodiaphragmatic recess because this is the surface has ribs on it, so that's costal pleura. That's the diaphragm, so that's diaphragmatic pleura, so that's the costodiaphragmatic recess. And that costodiaphragmatic recess clinically is probably the most important part of the pleural cavity. And what makes it so important is simply this. You can see that it is the lowest part of the pleural cavity. So that means that if fluid accumulates in the pleural cavity, whether it be a serous fluid, whether it be blood, fluid accumulating in the pleural cavity by gravity will drain to its lowest portion, to the costodiaphragmatic recess. So that's where you would expect it to accumulate. So on physical exam, if you're percussing the chest and trying to detect any pleural effusion or blood in the pleural cavity, this is where you'd expect it to be, in the costodiaphragmatic recess. Or if you were looking at a chest x-ray, this is where you'd expect fluid to be if fluid is accumulated in the pleural cavity. Secondly, the fluid is there, but the lung is not there. So that means that if you want to introduce an instrument into the pleural cavity for the purpose of draining the fluid, you can do it in the costodiaphragmatic recess because the lung isn't there, so you're not going to endanger the lung. So that makes the costodiaphragmatic recess a very important region, and that means it's very important that we be able to identify where that is on a patient's chest wall. And so what we can see is that by definition, the costodiaphragmatic recess is the space between the bottom of the lung, which we see here, and the bottom of the pleural cavity, which we see here. So if we can identify the surface landmarks that identifies the bottom of the lung and the bottom of the pleural cavity, then we'll know that the costodiaphragmatic recess is between. So what we see in this in a nutshell section are the landmarks on the surface of the body that tell us where the bottom of the lung and where the bottom of the pleura are found, both in the front of the chest wall, in other words, in a landmark that we call the midclavicular line, on the side of the chest wall, the midaxillary line, and at the back of the chest wall in the paravertebral line. So what this is telling us is that the bottom of the lung goes down to the level of the 6th rib in the midclavicular line, to the 8th rib in the midaxillary line, and the 10th rib in the paravertebral line. So as we go from the front to the back of the chest, the bottom of the lung reaches the 6th, 8th, and 10th ribs from front to back. The bottom of the pleura is 2 rib levels lower all around. So on the front of the chest, if the bottom of the lung goes to the 6th rib, the bottom of the pleura goes to the 8th rib. And on the side, in the midaxillary line, to the 10th rib, and posteriorly to the 12th rib. And so, therefore, we know that the costodiaphragmatic recess is between the 6th and 8th ribs in the front of the chest, between the 8th and 10th ribs on the side of the chest, and between the 10th and 12th ribs on the back of the chest. So if we wanted to ask the question of which intercostal space would you pass a needle through if you wanted to get into the costodiaphragmatic recess in, let's say, the midaxillary line, that would mean, since the lungs come down to the 8th rib and the pleura comes down to the 10th rib, the space in between would be the 9th intercostal space. So that's where you would pass the needle. If you were doing the same thing but doing it posteriorly in the paravertebral line, then the answer would be the 11th intercostal space. If we translate this chart into an image, what we would see is this. Here we're looking at the front of the chest, the back of the chest, and the side of the chest. And we can see that on the front of the chest, the lungs reach the 6th rib, the pleura reaches the 8th rib. On the back of the chest, in the paravertebral line, the lungs reach the 10th rib, the pleura goes to the 12th rib, and laterally, as we said, the 8th rib and the 10th rib. So that would tell us how to do that.